I'm real excited to bring my next guest to the show. It's Teresa Fletcher. Teresa is a certified nurse practitioner at Akron Children's School of Health Services, and we invited Teresa to the show because school is a couple of weeks away. And I know I've got one going back to college. I have two going to middle school now. Anxiety, stress, and for parents, you got to get your exams ready to go. There's a lot of things, Teresa, to get organized and ready for the beginning of school. And the first one is to settle down as parents because it's stressful and anxiety sets in with these kids. That's enough work for them.
Yes, that is very true. The anxiety for the parents to have their kids go back to school, and then also for those children having those new school routines after having a busy, hot summer.
Teresa, it's difficult to schedule it, but let's talk about the well child exams. And you talk about eye and hearing and getting that done. And also with certain kids at a certain age, they got to get their shots updated as well before they can go back.
Yes, well child exams are extremely important for every age group. Every year a child needs their well child exam. During that well child exam, they'll get their vision and hearing screenings. They also get screenings for mental health problems and behavioral issues. And then they get those vaccines that are required for school and good for your health. So back to school is a great time to think about that. Also, summer, fall time, there's sports that come along with school seasons, and so you need that sports physical signed off. Well child checks kind of encompass all of those things in a one-stop shop.
Teresa Fletcher is with us. She's a certified nurse practitioner with Akron Children's Hospital. Let me ask you this. With everything that has gone on in the school these days and COVID for the last couple of years, but there's also been some school violence and such like that, have you noticed more stressful situations and anxiety and parents and families reaching out for some help?
The change in society over the last several years has really taken a toll on the mental health of students and then families in that time. So I have seen that increase of that social anxiety, school anxiety, uncertainty of their safety in whatever community that they may live in. So it's definitely real, and I've seen it in practice on a daily basis.
Teresa, what are some ways that families and the children themselves can minimize anxiety?
So really, when you think about minimizing anxiety, it's about planning ahead. So if you can take the time to role play the first day of school, that can always help. Talk about with your child how they might introduce themselves to new friends or where they might sit for lunch. Take them back to school shopping. I know this weekend is Ohio's tax-free weekend, so a lot of people are going to be in the stores, but making it a fun experience for children to prepare to go back to school by buying, school supplies or new clothing could help with that. And then talking about friends that you already know that will be at school to support you. So if there's someone in your neighborhood that goes to the same school and connecting with them ahead of time will help them find a friendly face there.
Teresa, let me ask you this. When we talk about going back to school, it's exciting for so many families and children for sure, but there are those children who kind of have a stressful time with this, maybe bullying issues, and certainly with social media and phones and electronics, that's almost a 24/7 now. And I bring that up because I imagine conversations and communication inside these households is a real key in listening to the kids and the family members, parents, grandparents, guardians, relating them to try to ease this stress or anxiety that they may be having.
Yes, it's really important for families to normalize anxiety and talk about their own anxieties with their children so they don't feel like they're alone. It helps them relate and then get through those scenarios with themselves.
Teresa Fletcher is with us. She's a certified nurse practitioner with Akron Children's Hospital. Going back to school, the stress and anxiety, but it also can be fun and exciting. You also need to know some of the guidelines, and for parents, maybe school kids going to their schools for the first time, maybe they're finally into the elementary school or going to a new school. Talk about the school nurse and that role for us, Teresa.
So the school nurse acts as a bridge between your health and your education. So that school nurse in the nurse clinic can help the child with any ailments that they might have throughout the day, and provide medication if the parents provide permission for that, or monitor their chronic illnesses such as asthma or diabetes. In some school districts, I know this is in Akron Station, Akron Public Schools has a school-based health center where there will also be certified nurse practitioners available to see your children for wellness and sick care visits while they're in the school. So the family won't even have to leave school for their child to be seen by a medical provider.
Teresa, I know this is a case-by-case and family-by-family situation, but you've been involved in, I imagine, a lot of these conversations with families when we talk about the anxiety or the stress of going back to school, a new school, a change of a school district. All those scenarios are happening in the next couple of weeks. As a parent, a guardian, as maybe an older student, when do we know that it's time maybe to reach out for maybe some professional help outside of the family to help ease those situations? Because these mental health situations can be quite concerning for family members and those children.
Sometimes signs of mental health problems can show up as physical ailments. So a lot of times children might complain about upset stomach, have vomiting or headaches, difficulty sleeping, mood swings, becoming clinging to their parents or guardian, and then they might refuse to go to school. So if those things are happening on a regular basis with your child, I would recommend that you seek medical attention. And that's by just going to your primary care provider and having the discussion with them about the things that you're seeing in your home or the things that are being seen at school to be investigated for a mental health concern.
No doubt about it. Teresa, thank you for the visit. I'm sure are key words there for so many families getting ready in the next couple of weeks to send their children back to school. Thanks for the visit with us this morning.
Thanks for having me. Have a great day.
You too. Teresa Flesher, certified nurse practitioner from Akron Children's Hospital.